I'll be showing you C1-C2 screw fixation, right? See, first let me show you the anatomy. This is the spine model. You can see this is the C1 and this is C2. So the basic anatomy is this, you all know, this is the posterior tubercle, this is the posterior arch, and this is the C2 spine, this is lamina, and this is the posterior articular facet, and this is the lateral mass of C1. So we will be now planning C1 lateral mass screw and C2 pars screw. C2 you can go for a pedicle screw, but I usually recommend pars screw for beginners because it's straightforward and very easy. It is not that difficult as we all used to think. So before planning a C1-C2 fixation, you will have to know the anatomy well, and you will have to know the vertebral artery anatomy. The problem is the vertebral artery. So this is the foramen through which the vertebral artery comes. This is the foramen through which the vertebral artery comes, and through this foramen the vertebral artery comes and arches down along the posterior arch and then goes up. So while exposing the posterior arch from the midline till 1.5 centimeters is safe. But when you are doing a C1-C2 screw, you will have to expose this posterior arch till more further laterally. So one will have to look at the CT angiogram of the cervical spine to look at the vertebral artery anatomy and its various anomalies. Sometimes there can be a vertebral artery coming and hooking here and going, or it can go through this bone, or it can come here, arch more medially and go up. So you'll have to look at the vertebral artery anatomy. Once that is clear, so you'll have to expose C1 arch, and when you come laterally, don't use your monopolar cautery, use your periosteal elevator and keep pushing, so that even if the vertebral artery is there, you can push the vertebral artery lateral. You will have to expose the C1 arch till this end, so that you are able to visualize the lateral mass. So once you are exposed this, take your cautery and expose the posterior border of the arch, then you will hit the lateral mass. So you will have to completely expose the lateral mass laterally till medially. You should know the lateral border and the medial border. Once you expose the lateral mass, here is your C2 ganglion. It is advised to dissect the C2 ganglion, push it a little bit posterior, or for beginners it is always better to cauterize it and knock it off. Because if you preserve the ganglion and the ganglion gets irritated with the screw, then it's going to post-operatively the patient is going to eat up your head. So once you are very confident and you are an expert in this particular area, you can preserve the C2 ganglion. Otherwise, this area will have some capillaries and it will bleed, so you can sacrifice the ganglion and knock it off. So C1 screw, I would always prefer to use the C1 screw first. It's very simple. You expose this posterior part of the C1 arch, expose the lateral mass and go to the midpoint. And when you go to the midpoint, it is just straight and 5 to 10 degrees medial. Straight 5 to 10 degrees medial. And this craniocaudal tilt will be based on your C-arm, so that the tip of this trajectory hits at the anterior tubercle of the C1 arch. So 5 to 10 degrees medial, don't go too medial, you will hit the neural elements. So don't go too lateral, you will hit the vertebral artery. So straight or 5 to 10 degrees medial, and craniocaudal will be based on your C-arm guidance. You traject it to so that you hit the anterior tubercle. So that is C1. C1 screws you put like that. C2 is again even more simple. You can go for a pars screw. This is the lamina. And when you are exposing C1, so one should always expose the medial border, and when you put a Penfield or a Hutz or a dissector here, you will know the medial border beyond which you should not go, so that you damage the cord or the dura. Similarly, in C2, you expose the lamina, you expose this pars, and this you have to go down all the way here and definitely expose the posterior articular facet, because this is a landmark which will guide you to put the screws entry point and the trajectory. So once you expose the pars completely, so you will have to expose the medial border, you will have to expose the lateral border. So you know the medial border, you know the lateral border. So you will know the medial tilt of your pars screw. You will have to, the degree may vary from person to person, little bit 5 to 10 degrees. So you will have to expose this pars and go towards in the direction of the pars. And the entry point is you expose the posterior articular facet, and once you expose the posterior articular facet, the midpoint, not a little bit, 5 millimeters above the the lower border. This is your entry point and the trajectory is towards the pass. So you need not go beyond 18 to 20 millimeters. 18 to 20 millimeters is more than sufficient to go for a pass screw, which is equally strong as your pedicle screw. So this is your pass screw, this is your lateral mass C1 screw, C2 pass screw. And when you put a lateral mass pass screw, your screw should be a bit projecting up, so that unlike any other pedicle screw, your screw head, pedicle screw head will go flush with the bone. If you go flush with the bone, this pass screw is going to be up here and your C1 screw is going to be down here. So when you put a rod, the rod will be too much angulated down. And the screw should be a little more up so that the C2 ganglion doesn't get irritated and cause C2 neuropathy. So C1 screw should be a bit high, C2 screws and flush with the bone and take a rod. And once you put a rod, put an knee in C1 and little bit distract C1, C2 and then tighten your screws. So this is C1, C2 screw fixation. It's quite simple, quite easy, but definitely before putting a C1, C2 screws, go for a CT angiogram and look at the vertebral artery anatomy.